I do have a very supportive husband. I have a very supportive family.
The support helped Amy Bowles decide to leave her job in healthcare over a vaccine mandate. She knows family pressures are pushing other women out of their careers.
I know a girl who she has a young child already, and then she just found out she's pregnant with twins. She's obviously, that's 3 kids in daycare, so she's making the choice. Hey, it's going to make more sense for me to be at home with my children at this time.
We know there was a huge exodus of women from the workforce, and it's hard to tell how many of those women were pushed out of the labor force because they lost their jobs, and how much of that was kind of a pull factor from the demands that they were facing at home.
Dr. Lisa Levenstein is the director of UNCG's Women's Gender and Sexuality Studies program. She says recovery for women's careers could last years after pandemic disruption.
In terms of missed promotions, wage increases, they become less senior, they miss out on training opportunities, and these things really do add up.
The National Women's Law Center unemployment rates show a downward trend in recent months, but unemployment rose for women between September and October. Sectors like education and health services gained 64,000 jobs nationally last month. Most of them went to women.
Our labor force is still significantly segregated by gender as well as by race. There are still, large groups of occupations that are predominantly done by women.
I asked Dr. Levenstein if she expects things to change for jobs like child and health care.
What that would really depend on would be for us to start valuing women's jobs, such as teachers, people who work in daycare centers, people who work in healthcare as nurses and home health aides. If those jobs started to pay more, if they started to come with benefits, if they started to come with schedules that were more regular and that people had more control over, if those jobs became better, more people would want those jobs.